Hi, my name is Catherine. I'm going to do a head-to-toe assessment on you today. Before I get started, I'm going to wash my hands. Can you tell me your name,
Hannah,
where you are today,
my house,
and what today's date?
Friday.
Patient learned oriented times 3. And are you experiencing any pain, Hannah, on a scale of 0 to 10, 10 being the worst?
0.
Patient denies any pain. Next, I'm going to inspect your scalp. No signs of head trauma, no signs of lesions, and hair is evenly distributed. Next, I'm going to inspect your ears. Ears are symmetrical. And no signs of drainage. Next, I'm going to inspect your face. Skin is correct for ethnicity and is symmetrical. Next, I'm going to inspect your eyebrows. Eyebrows are evenly distributed, no signs of hair loss. Eyelashes are evenly distributed, no signs of hair loss, and eyelids show no signs of ptosis. Sclera is white and shows no signs of jaundice. Next, I'm going to check your corneal reflex with the light. Corneal reflex is present. Next, I'm going to check your pupils. Pupils constrict to light. Follow my pen. Pupils are equal, round, react to light, and accommodate. Next, I'm going to inspect your nose. Nose is symmetrical. Can you lift your head up? No signs of drainage. Mouth. Next, I'm going to inspect your lips. Lips are pink and moist, no signs of cracking. Can you smile? Frown. Puff out your cheeks. Cranial nerve 7, facial nerve is intact. Open your mouth. No signs of caries. Buccal mucosa is pink and moist. No signs of gingivitis. Stick out your tongue. Hypoglossal nerve, cranial nerve 12 is intact. Say ah. Cranial nerve 9 and 10, vagus nerve, and glossopharyngeal nerve is intact. Tonsils are not present. And soft and hard palate is pink and moist. Next, I'm going to inspect your throat. No signs of lesions or lumps. I'm going to palpate your carotid pulse. Carotid pulse is +2 strength and is equal bilateral. Next, I'm going to check your skin turgor. Skin turgor is elastic and patient shows no signs of dehydration. Next, I'm going to palpate your body temperature. Body temperature is warm and is equal bilateral. Next, I'm going to inspect your respirations. Show no signs of labored breathing or shortness of breath. I'm going to auscultate your breath sounds. Each time I move to a spot, please take a deep breath with your mouth open. Deep breath. Deep breath. No signs of wheezing or crackles. Next, I'm going to palpate your apical pulse. Your apical pulse is on your left side, fifth intercostal space, mid-clavicular line. Apical pulse is palpable. I'm going to listen to your apical pulse for a full minute. Apical pulse has normal rhythm. Next, I'm going to auscultate your heart sounds, starting with my diaphragm, starting at your aortic valve. Aortic valve is between your second and third intercostal space on your right side. Your pulmonic valve between your second and third intercostal space on your left side. Your tricuspid valve between your fifth and sixth intercostal space on your left side. and your mitral valve on your left side on your fifth intercostal space clavicular. I'm going to listen to your heart sound again with my bell, starting at your aortic, pulmonic, tricuspid, and mitral. No signs of gallops or murmurs. Next, I'm going to inspect your abdomen. Abdomen is flat and is symmetrical. I'm going to auscultate your vowel sounds, starting at your right lower quadrant with my diaphragm. Right lower quadrant, right upper quadrant, left upper quadrant, left lower quadrant. Vowel sounds are active in all four quadrants. Next, I'm going to palpate your abdomen and let me know if you're experiencing any pain. Right, starting at your right lower quadrant. Light, deep, any pain? Right upper quadrant, light, deep, any pain? No. Left upper quadrant, light, deep, any pain? No. Left lower quadrant, light, deep, any pain? No. Patient denies any pain and no signs of mass. Next, I'm going to inspect your upper extremities. Upper extremities, joints are equal bilateral, no signs of bruising, no signs of rash. Next, please have your arms up for me. Push against. Good. Grip on my finger, squeeze. Strength is present and grip is present, is equal bilateral. Next, I'm going to palpate your upper extremities body temperature. Upper extremities body temperature is warm, is equal bilateral. I'm going to palpate your radial pulse. Radial pulse is +2 strength and is equal bilateral. Next, I'm going to assess your capillary refill. Capillary refill is rapid and is less than 3 seconds. Next, I'm going to inspect your lower extremities. Lower extremities joints are equal bilateral and no signs of bruising or rash. Next, I'm going to inspect your strength. Push against my arm. Good. Flex your right foot, your left foot. Strength is present and flexion is present and strength is equal bilateral. Next, I'm going to check your pretibial edema. No signs of indentation. Next, I'm going to palpate your posterior tibial pulse. Posterior tibial pulse is +2 strength and is equal bilateral. Next, I'm going to palpate your dorsalis pedis pulse. Dorsalis pedis pulse is +2 strength and is equal bilateral. Next, I'm going to check your capillary refill on your great big toe. Capillary refill is present and is less than 3 seconds. Thank you for your visit today.